In terms of incisions, where can we access the pocket that we're going to create? There are 4 options available to us. The first one is through the belly button, and that's called a TUBA, Transumbilical Breast Augmentation, and that currently is only done with saline implants. We can put it through the axilla, through the armpit, and the advantage of that would be that we put the implant in without any incisions on the breast at all. I used to do all of my incisions there, but it became apparent to me that the recovery was dramatically different and placement of the implant was much more difficult. So revision surgery was higher in terms of the implant position, and also the discomfort was dramatically different. The other incision next would be the Periareolar Incision, one below the nipple. And the advantage of that in some people's mind is a better looking scar. Personally, I think that that scar is more out front, more noticeable, but it also carries with it a little bit higher risk for numbness, infection, and capsular contracture, which again is that hardening issue. The vast majority of the time, the incision that I will use is in the fold, and the advantage of using that fold incision is several. Number one, if you have an anatomical implant, it allows us to place this and orient it. I can actually see this line that is on the implant so that we can orient it properly. Also, it makes it easier for me to control the fold if we need to move the fold up or if we need to move the fold down. It makes it easier to do that. And if for whatever reason we have to go back in and reposition an implant, this incision allows me to do that much easier. So for that reason, I tend to use the infamammary fold much more commonly.